my name is Dr. Luis from Homemade Pet Hospital.
Hello, my name is Gosia. I came here for ultrasound training.
Okay, so today, which case you want to learn? What kind of case?
About some hernia.
Yeah. So maybe you can talk a little bit information about the animal.
So the animal came to different clinics, and all of the doctors said that it's a problem with the heart because they did X-ray and the heart looks very strange, very big. And the owner was confused, and he came to this clinic, and Dr. Luis did ultrasound, and she found the heart is maybe it's the heart problem or maybe it's a hernia. And to confirm this diagnosis, the owner did CT, and it was hernia. The liver went through the hole and connected to the heart.
So let me tell a little bit there about the story. So the cat is around 5 months old and is female, and the owner found the cat when the cat at home seems to be tired, and especially when the cat running after running, and the cat seems very tired and also sometimes open mouth breathes. And the owner worried about the cat because the owner had one cat died suddenly. So the owner was told the reason for the sudden death of the cat is heart problem. So the owner worried about the cat, then bring the cat to the first clinic to check. They did X-ray and found the shape of the heart is very huge, rounded and huge. And then they said that it is HCM. They think the heart is getting larger, but actually the HCM will not cause some change on the X-ray. So, but the owner also takes the medicine for 1 month, and 1 month later come back to the first hospital to check again. But the heart shape is still very huge, and then the owner go to the second hospital, and they tell the owner that cardiac fluid around the heart. So the owner was confused. The owner thinks that give a different diagnosis. So the owner brings the cat to me because she checked from other place that I'm good at ultrasound. So bring to me. I did ultrasound, and I found a hernia. I found the liver already go inside of the go inside the percaridal sac, not only diaphragm, go inside the percaridal sac. So that's why the shape of the heart is very rounded. And I told the owner, and the owner told me 3 hospitals gave me 3 different diagnoses. So which diagnosis I should leave? So I told the owner, okay, no problem, you can go to do CT, and then the owner go to CT and confirmed my diagnosis, and then I did surgery and helped to bring the liver move back to the abdomen. But the liver stick to the heart actually, already stick to the socks of the heart. So the surgery is quite a little bit difficult, but we managed it and saved the life. So this is the cat. This is the photo after 开始. So this is the cat. This is the photo after we did the surgery. You can see the cat is quite beautiful. And the cat was around 7 months, female, and tired after running. And the cat was sent to our hospital, as I mentioned, and they did X-ray and found the heart is very huge, you can see. So normally the size of a heart should be between 3 ribs, but now you can see already 5 to 6. So very big, very huge. And then they gave the medicine for 1 month, and 1 month later recheck the heart still very big. So they gave the diagnosis as HCM, but I think it's quite strange for this diagnosis. And another diagnosis is DCM. But as we know, they both cannot happen in one cat, right? So the two diseases cannot happen in one cat for me, I think. And then they send it to another hospital and diagnosed as a precordial fluid. So the owner was confused and then sent it to homeopathy hospital and found me. And then I did the ultrasound. So this is the heart. You can see the heart at the moment. The shape of the image is a little bit strange. It is not so clear. And this is short axis of the mushroom. And this is left ventricle. And here is pulmonary muscle. And the chamber of the left ventricle, it is quite small. It could be because of HCM, but when I measure it here, it is not so thicker. So, and we found something strange around the heart. This part should be numb, but now it is something like liver. So this tissue squeezes the heart, so makes the heart very difficult to pump. So we see this again. This is the short axis, and here we see the liver again, and here we have a video. You can see here is a heart, and here is liver. You can see normally we should have the heart and the lung around. So if you saw this kind of situation, it could be the liver going inside, and also could be because of a lung disease. If the lung have disease and low gas in the lung tissue, and they also can have the similar image. Okay, so here another video, and we can see here is the you can see here is a free fluid in the chest, a little bit of free fluid in the chest, and here is the liver, and here is the gallbladder, and here is heart. We see again, here is heart, and here is the liver, gallbladder, and the free fluid. Again, heart, free fluid, liver, gallbladder. So here is another. You can see here is the heart, and this is the right ventricle, right auricle, left ventricle, or left auricle, and here have a mild free fluid this area, but for me I think it's not so important. And this is heart. So there's something squeeze the heart, make it very difficult to pump. And here we check the liver, and here is diaphragm, and from here the diaphragm should very smooth from here to here, but it is broken. The diaphragm is not continued, and we see a lot of liver tissue in this area. Here the diaphragm is broken, not continue anymore. Okay, so my diagnosis is a precordial hernia, and then I recommend the owner to do CT, and you can see here is a heart. Here is very rounded sense is the precordial sac, and the liver already go inside, so that's why the heart is very rounded and very big. The liver squeeze on the heart. So I told the owner I did surgery, and unfortunately my reception girl did not receive my video, but we still can show many photo, and here I separate the liver from the sac. And after that I did the x-ray just after surgery. You can see this is the heart, and this is before the heart. And 3 days later I do the echo again, and you can see now the diaphragm already become smooth, and we can see the gallbladder in the abdomen. Again, this is liver, and this is the diaphragm, and here is the heart. Okay, so now the heart is become bigger, and you can see the chamber of left ventricle is become wider. That's good. So the owner is very happy, and we are also very happy about the result. So I think this case is very interesting, and I'm very happy that with the color ultrasound we helped the animal, and now the 3 days after the surgery, the cat become normal, and we recheck the heart look perfect. And then now the cat is happy and already almost 8 or 10 months passed. The cat's still very happy. So the owner is very happy. So here I would like to say thanks to Dr. Koch, who brings knowledge of color ultrasound from Europe to China and trained me, and also provides this wonderful machine. With this machine, we did the diagnosis, and we helped the animal. We improved the life quality of this cat, and so also improve the animal welfare in this cat. So I'm very happy with this cat, and thank you for watching. Bye bye.
Bye bye.